Provinces and territories are beginning to lift pandemic-related health measures this month. Many are set to abolish the vaccine pass along with mask mandates. After nearly 2 years of COVID-19, the prospect of returning to normal may seem exciting, but perhaps a little nerve-wracking. Dr. Evan Adams is the Deputy Chief Medical Officer at Indigenous Services Canada. He joins me to discuss the big lift. Welcome to the show.
Hi there, how are you?
I'm well. Dr. Adams, what advice is your department offering communities as neighboring jurisdictions loosen up?
There are probably a number of reasons why some jurisdictions are lifting public health measures. Some of them are not related or not directly related to health. They may be related to, say, to economic recovery or, just allowing people to be to leave home and go back to work or school. But we're definitely supportive of self-determination in communities. Communities can decide. They may want to weigh factors like how much COVID is right nearby. I know some people have been using the terms mild disease, but there can be long-term sequelae, especially for those with most risk, like older people, babies, um, those with chronic diseases, and we should probably get used to some disagreement amongst ourselves, like within families, within communities. Some communities are eager to open for business. Others are saying we're not ready to open. We don't feel safe yet, and that may be true for workers. That may be true for students. Some eager to go back. Some saying I would like to wait a little bit before we open things up. So it is going to be a bit of a mixed bag out there. I do expect that there will be some conflict or tension between people, and I think some people will be unhappy or outraged about how things are going.
Well, you mentioned the possibility of other motives aside from health for lifting restrictions. So what is your message to people who may be feeling anxious about losing the mask or ending physical distancing?
I would say that it is well within your right to express your uncomfortableness with how things are going. So, for instance, we are telling employers that it is possible that some of your workers may not want to return. We're telling schools it's possible some of your students will say that they wish to keep masks on or to continue social distancing and some of the other public health measures that they've gotten used to. So we should be ready. We should be ready for that. And from a health point of view, if we were just looking solely at health, the safest thing would be, to not encounter anyone. So we do know that that's not always possible. So um, uh, we should all expect to be somewhat uncomfortable, I think, at some point.
What do you think the future looks like going forward? Is COVID something we eventually learn to live with from now on, just like the seasonal flu?
I think our journey with COVID is still has a ways to go. So, for instance, we are looking ahead towards perhaps another variant of concern. I think we're still learning how to adjust to the new reality. I think there is some healing that can happen now, in that some people are quite frustrated and tired. I think mental health has suffered. I think some people are actually having setbacks that are, economic or related to their academic achievement or to related to their workplace. I like to think that we as Indigenous people know all about healing. That even though we're tired and perhaps frustrated, we do know that we can get better. So I do see this as a time for healing and feeling better about what's happened.
What are some ways Indigenous communities can prepare right now for future waves or variants that may be coming, as you just indicated?
Because of sheer numbers of persons with Omicron, perhaps you are more likely to have mild disease, but you're also more likely to have complications. So we're still recommending to people to be vaccinated. And we also are recommending self-determination, self-determination being the right of a nation to determine its own course without interference from other nations. So if your neighboring jurisdiction or your health authority or your province is opening up measures, it doesn't mean you as a First Nation have to. And also the rights of individuals, the right of the individual to self-determine. You can't be forced to go into situations that are uncomfortable for you.
Well, the right of self-determination has been a big topic here in Ottawa with the protests. Do you think voluntary vaccination will be the new normal, or could we see the return of mandates if things do get tough with COVID again?
Well, we do know that the vast majority of people believe in vaccination and believe in the realities of COVID. And I personally don't see wearing a mask as an issue of freedom so much as safety. So I wouldn't conflate the two. But again, I do want to reiterate that we will always have vaccinated and unvaccinated amongst us. And those who are nervous about COVID and those who minimize COVID are mixed together. So I personally have seen the divisions between us as being really quite damaging to us personally, to our mental health, and to our families and societies. So I do think we should learn to be kind to each other and not have schisms between us.
Well, I think that's a good place to leave it. Dr. Adams, I appreciate your time. Thanks for being here.
No problem. Thanks.